Admit.
And you can start with your introduction, and then I'll do the introduction of Sarah.
All right, we didn't have to. Let me want to make sure. All right, good afternoon, everyone.
Good afternoon.
Happy to have you all here. Thank you for joining us. And apologies for the glitches and the slightly late start. We've had a number of issues at the last minute, but I think we're on our way. I'm Valerie Gordon, president of the CEI. With me co-hosting is Nadine Persad, who is our director of professional development and training. And of course, we have Sarah Gharbi from ALNAP, who will be our facilitator for this session, and her colleague, Waramu Wanjao from ALNAP also. I'm going to ask you all to introduce yourselves really quickly and then hand over to Nadine just to introduce Sarah. It's a tight ship, so we'll have to move we'll have to be very efficient. Okay, Sharika, introduce.
Hi, good afternoon, everyone. My name is Sharika Rogers. I am a research assistant. I work specifically with Curleen Beckford, and I'm happy to be here to learn from all of you. Thank you.
All right. I see Beverly from GSD.
Hi. Hi, everyone. I'm Beverly Lamoha, and I'm the Global Partnerships Manager at GSD. Happy to be here as well. Thanks.
Great. All right. Curleen.
Curleen Beckford, Director of Membership, CEI. Glad to be here.
Grayson Cornwell. Okay, Grace.
I think Grayson wrote in the chat.
Yes, her microphone isn't working. Edward Williams from Grenada, M&E Specialist Consultant. He's on the road, can't speak. Thank you, Grayson. Welcome. I didn't see what was in the chat. Jeremiah Fumba from Liberia, Monitoring and Evaluation Officer. Welcome. Who else I see? Human Daoud.
Hello, everyone. I'm Humam Dawood. I work with ALNAP. I'm the Digital Engagement Officer.
Thank you. Welcome, Human. Murad. I see Murad.
Hi. Good afternoon, everyone. Murad Malik, Meal Manager at Global Support and Development.
Welcome. Thanks, Murad.
Thank you.
I see Lisa. Thank you. I see Lisa Hall from LPD Hall and Associates. We work in organization design and performance. Welcome, Lisa. She's a member of the CEI as well. Manoj Khadka, GSD.
Hi, everyone. My name is Manoj Khadka. I'm technical advisor for program quality and meal team within GSD. Happy to be here.
Awesome.
Thank you.
Lovely to have you. Margaret Bramble.
Hello, good morning to all. I'm a board member of CEI and looking forward to the session.
Awesome. Thanks, Margaret. Melanie Ines. Whoops.
Hi, Melanie, M&E consultant and a member of CEI. Looking forward to the session.
Awesome. Othniel Hemans.
Hi, good afternoon, everyone. I am a consultant. I do work with the Ministry of Finance in the role of a program manager, also M&E consultant, and many other roles, but I'm a part of JAPOOP as well. Thank you.
Right. Welcome, Othniel. Thank you. Zara Miller. Let me check the chat. Okay, maybe she wrote something in the chat. You can check Sharika. And then we have Nicole. Go ahead, Nicole.
Hello, evening, everybody. I didn't quite get the instructions. Could you just run it
Oh,
quickly
just a quick
again, please?
introduction. Just a quick introduction saying who you are. We're
Hi.
doing introductions.
Okay.
Mhm.
Hi, I'm Nicole Martin Chen. I am from Jamaica. I am a director at the Ministry of Health and Wellness, and I am also a member of the CEI board and Jamaica Pope. Thank you.
Lovely. Thank you. All right. Do we have everybody? Yes, I think
Zara says
so.
her mic isn't working. But she's Zara from Jamaica. She's an evaluation consultant and CEI member.
Awesome. Thank you. Think we captured everybody. All right. Over to you, Nadini.
Thank you, Valerie. So I'm going to introduce, I've actually didn't do my introduction. I'm Nadini Prasad. I'm the Director of Professional Development at CEI and a Senior Lecturer in Evaluation at UWI, Barbados. So I'm now going to do a short bio introduction of Sarah. So Sarah is a research fellow at the Active Learning Network for Accountability and Performance, ALNAP, with nearly 20 years of experience in the humanitarian and developmental sectors. She has worked with the Swedish International Development Cooperation Agency, several international NGOs, and the International Red Cross and Red Crescent Movement as an evaluation advisor, researcher, and evaluator. She is the co-author of ALNAP's most recent evaluation guide, Adapting the OECD Criteria for the Evaluation of Humanitarian Action, which was published earlier this year. So without further ado, I'm going to hand over to Sarah, who is our facilitator for today's session. Over to you, Sarah.
Thank you so much, Nadini, and thank you, Valerie, for the introductions. It would be great if we could display the PowerPoint.
The PowerPoint is up. You'll need to tell me when to move forward.
Okay, I can't see it.
Oh,
maybe.
okay.
I was seeing it.
Are you seeing it now?
Yes, I'm seeing it on its way. Yes. Great. Thank you very much. And hi, everyone. As Nadine mentioned, my name is Sarah, and I'll be your facilitator today. I'm based in Tunis, and the internet connection here is always an adventure. So please bear with me if my connection breaks up, and I'll switch to another connection. I've been at ALNAP for 3 years, and I've worked mainly on evaluations. And during those 3 years, I've mainly worked on the guide that Nadini mentioned earlier. Today, the goal of today's session is to introduce some of the challenges specific to the evaluation of humanitarian action and kind of what differentiates the evaluation of humanitarian action from other types of evaluation. And right up top, I will warn you that I will use the acronym EHA, which stands for Evaluation of Humanitarian Action. I'll try my best to not use too many acronyms, but that one it's become kind of part of my natural language. So I'm afraid it'll be difficult for me to avoid it completely. Today's agenda, we'll start off with just some key definitions to kind of frame our discussion and that are important to get a good background to what humanitarian action is and the specificities of the evaluation of humanitarian action. Then we will go into specific challenges with the humanitarian action. After that, we'll do some group work, and at the end of the session, I will present mitigation measures, things that are good to kind of consider and think of when you're facing those challenges that we've been discussing throughout the session. Next slide, please. Just some housekeeping. Great if you can keep your microphone disabled. If you have questions, please leave those in the chat or unmute yourself during Q&A. There'll be 2 instances where we stop and kind of take questions, and I'll be able to answer them. But please feel free to also put questions in the chat during the session. Next slide, please. I just wanted to say a few words on ALNAP, since all of you might not be familiar with us. We were created in the 90s after the genocide in Rwanda as a mechanism to advance humanitarian learning. A lot of mistakes were made in the humanitarian response in Rwanda and in Congo, and ALNAP was set up as an international mechanism for humanitarian learning. Our goal is for all humanitarians to benefit from our sector's collective experience, and we support humanitarians everywhere at a global level to improve humanitarian action by exchanging evidence, experience, and practical ideas. We are a network, and we're made up of 100+ members. Next slide, please. Something that we've been doing ever since the start is to support evaluators in different ways. We've published evaluation guides for over 20 years, but we also have one of the sector's largest databases of evaluations. We do training sessions like this one, and we also convene evaluators and more broadly M&E staff to discuss burning issues and to push the agenda on issues that are important to humanitarian evaluators. On the screen, you will have 3 of our evaluation guides. To the left, you have the Evaluation Humanitarian Action Guide, which is our very comprehensive, long guide. And our session today is based on parts of that guide. You will have links in the chat to all 3 guides. I can see the link to the first one, to the EHA guide. It was published in 2016 and is kind of at the core of what we offer evaluators. As a companion guide, 2 years later in 2018, we published the Evaluation of Protection in Humanitarian Action. And then last year, we published Adapting the OECD Criteria for the Evaluation of Humanitarian Action. And I co-authored that guide, and we will offer a second session in partnership with CEI on that guide at the end of February. Next slide, please. So we have our first poll. And you will access that poll by going to Mentimeter, and my colleague Wabrimu will put the link to the Menti in the chat. So you can just click on the first poll, and everyone's most welcome to answer that question, which is very simple. It relates to how much experience you have of EHA, Evaluation of Humanitarian Action. And Wabrimu, I assume you can see answers coming in, so I'll let a couple of minutes pass to give you the chance to answer the question, and then I'll be able to see the results as well. So the link to the poll is in the chat.
Sarah, so far we have 7 none, 7 some, 2 extensive.
That's a lot of quick responses. So 7 some, 7 none, and 2 extensive.
As of now, we have 9 none, 8 some, 9 none, 9 some, 2 extensive.
Great. So it kind of, I think we should be able to have really good discussions. And those of you who have some experience, please feel free to share those experiences in the group work later on. Thank you for your quick responses to the poll. We'll quickly move on to the next slide.
I'm not sure if a stop has to be made to the poll because I'm not moving forward.
I don't think the PowerPoint and the poll are linked normally.
Let me stop it and start again.
Okay. Yes, so this part is me just wanting to kind of quickly frame our discussions today by introducing some definitions, some key definitions to the topic. The first key definition is obviously humanitarian crisis. And there's no set definition to what a humanitarian crisis is. They can be triggered by many different causes and can have very different characteristics. They can be caused by armed conflict, by rapid onset natural disasters such as earthquake or flooding, which I think you see often in, or maybe not often, but you see, you've witnessed and experienced those in the Caribbean region. And then you have more slow onset natural disasters such as drought, or health crisis such as Ebola. So causes of humanitarian crisis vary a lot, and that also means, of course, that the response to those crises can look very differently based on what type of crisis you have, but also based on what the national capacity to respond is. For example, if state capacity is very limited and international agencies need to come in and perform a substituting function to the state because capacity is very low. But there are also humanitarian crises where state capacity is very strong, and there the international community plays more of a collaborative role or may not even be needed. An example of that is, for example, the big earthquake that hit Turkey and Syria a few years ago, where the state capacity in Turkey was very strong, and so the international system or international agencies did not play the same role in Turkey as in Syria, where state capacity, because of the civil war, was much weaker. I think it's very important, especially nowadays, to also think about timescale and frequency. And most humanitarian or most international humanitarian formal funding nowadays go to protracted crises. That mean crises that go on for years and years and years. And examples of that are Democratic Republic of Congo, it could be Sudan, it could be the Sahel countries, where humanitarian needs remain at a very high level for years on end. You can also have recurrent crises based on a cyclical events. For example, drought and associated nutrition crisis in the Horn of Africa. And you can have rapid or slow onset. So there's not one type of humanitarian crisis, which means there's not one type of humanitarian response, which also means there's not one type of evaluation of humanitarian action. Next slide, please. So what's the ALNAP definition of humanitarian action? It is the objectives of humanitarian action are to protect and save lives, to alleviate suffering and maintain human dignity during and in the aftermath of crisis, as well as to prevent and strengthen preparedness for the occurrence of such situations. There are a few key words here that I wanted to highlight. One is to protect. Protection is a key dimension of humanitarian action, and it's something that's become more and more apparent that there is a need to reinforce protection mechanisms in humanitarian crisis. Another key word, or one that I think is important to highlight, is human dignity. Just because people are suffering and are going through unimaginable trauma does not mean that humanitarian actors and evaluators do not need to ensure that affected people are or they need to ensure that affected people are treated with dignity throughout whatever programming is in place or throughout any evaluation exercises. Next slide, please. A lot of humanitarian organizations abide by the humanitarian principles. That I wouldn't say that every humanitarian organization does, but it is a very important, those are very important principles for a lot of humanitarian organizations. And those principles are humanity, impartiality, neutrality, and independence. And you have the definitions on the screen. And those traditionally or historically have not been evaluated frequently, but there is a push in the humanitarian evaluation community to consider the humanitarian principles much more in the evaluation of humanitarian action. And the UN published a guide on how to consider the principles 2 years ago in 2024, which can also be very useful when you embark on an evaluation of humanitarian action. Next slide, please. And finally, the definition of the evaluation of humanitarian action. So EHA, the famous acronym that I'll probably be using a lot too much, is a systematic and objective examination of humanitarian action to determine the worth or significance of an activity, policy, or program with the intention to draw lessons to improve policy and practice and enhance accountability. I think that all of you are familiar with this this definition, and I think what kind of sets it apart from other definitions of evaluations is the focus on humanitarian action. And EHA can obviously go beyond just the evaluation of an activity or a program. It can also be the evaluation of humanitarian policies. Next slide, please. Any questions on these definitions? You can unmute yourself or feel free to add your questions to the chat. Yeah. Maybe it was all crystal clear.
Hi, Sarah.
Yes.
So my question is in regards to the push to evaluate the humanitarian principles. I guess I'm just curious to know what that would look like if that was to happen. I know you said there are some UN guidelines on how to go about that, but like if you could provide like an example of what that would look like. Thanks.
Yes, of course. And maybe I can also add that in our latest guide on the OECD criteria, we map out the criteria against the principles. So one example that I can maybe provide, let me think, is against, if we go back, maybe we can go back a couple of slides, just so I have the principles. We have the principles and the definitions. Yes, next slide. And if we do next slide. We're going in the wrong direction.
Okay.
There we go. Impartiality, for example, the principle of impartiality is to ensure that humanitarian needs or humanitarian response reaches those most in need without discrimination. And so an evaluation of impartiality might look at who was reached by humanitarian, who was targeted, and then who was reached by humanitarian action. And if those decisions that were made on who to target and who to reach were on what basis were those decisions made? If it was on, if impartiality and was a factor in that decision, and if it was needs based, basically, and if there are any groups that should have been targeted and reached who were not targeted, perhaps because attention was not paid enough to certain discriminated groups or certain vulnerable groups. Beverly, I hope that provides one example. There's lots of examples in both the UN guidance and in our guidance as well on how to consider the principles.
And so how would you capture like all the humanitarian organizations that are doing this?
How you would capture all the humanitarian organizations that were.
Because isn't the goal to evaluate the humanitarian organizations that are in compliance?
Yes. So in an evaluation, you would most often evaluate either a program or an organization. So you can evaluate or examine, assess the decisions made and within the frame of a program or of an organization. You can even look at several countries that an organization is active in. There are very few evaluations that consider the response of all humanitarian organizations in a humanitarian crisis. The most frequent type of evaluation that does that are the interagency humanitarian evaluations, and those look at the response overall in a country. But most of the time, you will look at a single program or an organization's programming in one or different countries. Great. Ravimu, are you ready for the second poll? And Ravimu also put the link to the UN guidance on humanitarian principles in the chat. And so there's now a second poll.
Yes, I'm ready.
And that question is, which aspects of humanitarian context do you think makes evaluation most difficult? And you can only choose one. I'm being a bit strict here. Rapidly changing context, multiple actors and coordination challenges, ethical considerations and risk of harm, measuring outcomes beyond immediate outputs, or operating under crisis and time pressure. So Ravimu, I'll need you to maybe give me the top two once we have a few responses.
Okay. So far, from 14 results, the first one is 5 responses is multiple actors and coordination challenges. Then the next one is rapidly changing contexts with 4 responses.
Great, thank you very much. I do think that from my own experience working in different humanitarian crises, coordination is it's probably the biggest challenge. And it's also where it could really change the nature of a response if coordination works. And if all of the actors involved actually talk to each other. Unfortunately, that doesn't always happen. I would say that it happens quite seldomly. So I do agree that that's a really big challenge, both generally in humanitarian action, but also in the evaluation of humanitarian action. Let me see if we can get the next slide. Yes, so I'm just going to quite quickly run you through generally what are the biggest challenges that are specific to the evaluation of humanitarian action and that you might not encounter in other types of evaluations. These are sourced from our EHA guide, and there's much more information there if you really want to read up on them. And I would say these are quite generic challenges. Of course, the different contexts can have their own set of challenges, but these are the ones that personally I've encountered quite often, both as a humanitarian worker, but also as an evaluator of humanitarian programming. So the first one is the urgency and chaos of humanitarian emergencies. Depending on the rapidity of the crisis, how if it was a rapid onset, for example, everything will happen very quickly, both in terms of damages and damages to infrastructure, in terms of mortality, in terms of negative consequences for affected people. And that also means that humanitarian action will have to, it's in the nature of humanitarian action to also respond very quickly. That means for evaluators that if you arrive to the scene a few weeks or a few months after the start of the humanitarian response, it can be quite difficult to understand the logic of the program, of the theory of change. And there is very often a real lack of baseline data just because there wasn't time to collect, to do a proper baseline. And so as an evaluator, you kind of the data that you will have, or the understanding that you will have at the start of the evaluation might be quite fragmented and not give a full picture of what happened. Another challenge, which is specific to humanitarian action, is the very high turnover of staff. And that means that there might be, in very big responses, there might be turnover of staff and staff that only stay the first week of the response, and then gradually, as the response stabilizes, staff might stay a bit longer. It might be 2 weeks, 3 weeks, or 4 months. So you have an extremely high turnover of staff, and that obviously means that for evaluators, you need to find people who know what they're speaking of, who know the program, and you might not be able to identify staff that have been there from the start of the response. A third challenge is, of course, pressured and stressful working environment. Obviously, working in humanitarian crisis can be very difficult and very stressful because you are working under immense pressure. Staff might be working 7 days a week, might be working 16 hours a day, and that obviously can create an environment that's not always the most conducive to evaluations and to welcoming evaluators and the exercise of evaluations. Next slide, please. So now I'm just dumping a lot of problems on you, but fear not, we'll also discuss solutions. Another challenge which is specific to HA is remote locations and damaged infrastructure. The road that you might need to take to a location might not be working, or it might be cut off by flooding, etc. So you might not have access to affected people. You might not be able to observe and to visit program sites. Obviously, affected populations are preoccupied with survival needs, and they might not be available to answer questions, and they might not have time nor brain space to answer questions by evaluators. And then the third challenge of this slide is, it goes back a little bit to the issue that ranked first in the poll, which is the lack of clearly defined responsibility between humanitarian actors. There might be a lot of overlap between humanitarian actors, and that, of course, creates attribution and contribution issues for evaluators, because it might not be very clear on who did what when. And as an evaluator, you need to kind of figure out as best as you can what the program that you're evaluating, or the organization that you're evaluating, what their contribution was to the humanitarian response. Next slide, please. Then there are some challenges which are specific to conflict. And one of them is that conflict polarizes perspectives. So there might be very kind of different perspectives and views, both on the crisis itself, but also on programming. So you might not at all be able to get that cohesive, coherent analysis of what happened, and you might need to consider that in a conflict there are also interests from different parties to influence programming, to influence how the crisis is portrayed. The second challenge, which is specific to conflict, is a breakdown of trust, where there has been politicization and trauma. An example of that is on one of my first assignments as a researcher. I went to the Democratic Republic of Congo. I went there with Doctors Without Borders. And in Congo at that time, it was in 2008, all INGOs, all international NGOs, and the UN agencies were conflated into one. And the UN had a very bad reputation in DRC, which made it difficult for us as staff of Doctors Without Borders to be trusted by affected people, because for them it was same. They saw us as the UN, and they did not trust the UN. So there might be trust issues between organizations, between different conflict parties, between evaluators and the affected people that you need to consider. Of course, there's also issues around trauma, and not only the trauma that affected people who are program participants have experienced, but also trauma that have been experienced by humanitarian staff. And I think that's an aspect that's often not explicitly considered, is that humanitarian staff also suffer or can suffer from a lot of trauma from what they have witnessed, and from the sense of perhaps helplessness of not being able to help enough. And that, of course, is especially relevant for national staff in a conflict or in a humanitarian crisis. They might be personally affected by the crisis. Family members might be affected by crisis. And then, of course, the big challenge in conflict settings is insecurity. So it might be very difficult to access parts of the country, parts of a region, because of insecurity. And that's, in my experience, a big drawback or a big challenge when doing evaluation of humanitarian action, is that you might not be able to get access to affected people. You might not be able to go where you would like to go because of insecurity. Next slide, please. Yes. So we'll take a quick 2-minute break. So those of you who want to kind of get your cup of coffee or get your notebook, because the next activity will be a group discussion. Now is the time. You'll have a couple of minutes, but also if you have any questions, you can put that in the chat or unmute yourself and ask me if you have any questions.
What time should they come back, Sarah?
In 2 minutes. So it'll be super quick break.
Sarah,
Yes.
just want to ask
Yes.
the standards of evaluability, as it's officially defined. Those standards pretty much go out the window in these situations. Am I not? Yeah. Because in a rapidly changing situation, or in the face of the onset of a tragedy, natural disaster or whatever, who has time to develop a TOC and a log frame and proper indicators and things like that?
No, exactly. So in kind of rapid onset humanitarian crisis, that is very difficult. We'll get into it, but sometimes humanitarian organizations have some sort of basic theory of change because they've applied for funding, and so they'll be able to present some sort of basic theory of change. Now, that theory of change might not have anything to do with reality, and that's also something can be quite challenging. In more protracted crisis, where a humanitarian response has been going on for a year, 2 years, you might be able to get more solid kind of background information. But I think evaluability is a big challenge, and it's also a big challenge because the responsibility in parts rests on the commissioners of the evaluations. And having that dialogue with the commissioner during the inception phase is very important in evaluation of humanitarian action, because you really need to figure out, okay, what is actually feasible, even if the TOR asks you to go to a certain district or speak to certain groups. Is that still feasible with changing conditions? And if not, how can you come up with an alternative plan? But now I'm going into the group discussions. Any other questions before we go into group discussions?
There are no questions in the chat, and I'm not seeing any more raised hands, so we can possibly go into the
Yes,
breakout room.
we can go to the next slide. And then the next slide. Yes. You'll be automatically distributed into breakout rooms. There should be approximately 5 people in each group. And Warimu will now share. Originally, we had thought to put the whole text in the chat, but there were too many words in the assignment, so we weren't able to. But Warimu is going to share a link to a document, to a Word document, where you'll, a PDF even, where you'll be able to read a scenario, and in that scenario, you'll have a couple of questions to discuss in the group. It will be important to keep an eye on the chat during the entire discussions, because as we know, things can change quickly in humanitarian context. And in total, you will have 25 minutes to discuss, and then you will report back in plenary. So please nominate somebody in the group to report back.
Should I open them now?
Yes, so maybe wait. So we'll also share the link to the document in the chat in the breakout room, if you haven't had the time to open them now. But yes, Rami, you can go ahead and open them.
Okay. Give me a second, please.
Yes. So just to repeat, you have a PDF in the chat that you need to open up, and you'll have instructions in the chat, in that document, with a scenario and questions to discuss in the group. And then Warimu has opened up the group rooms, so feel free to join your room.
Some people are not yet. Okay, okay. Group 2
There were a
has
couple of
1,
people.
2, 3. One person is gone. Okay. Shelly Anderson is still okay. The only person who she is on the road is Margaret Ann.
Great. So everyone is in groups that should be in groups.
Yes, Dr. Nadini, did you want to be in a group for the time being or not?
You can just put me in the group to listen in. Yes.
Okay, fantastic. Okay, let me just assign you to group 3. Okay, great. I'm going to try something right now.
Are you going to try to broadcast the document?
Yes, apparently there might be a way to do that. And it's shared to breakout rooms. So apparently it's now shared to all breakout rooms.
The document or the link or both?
The screen, my screen is being shared to all the entire breakout. So they're seeing what this is currently on their screens. So
Why?
in case nobody can't open it.
But I see that your chat with me, so maybe.
You see my chat?
Yes.
Damn it. Stop share. Why? It should be desktop too.
But as long as they have access to the document.
Do you see it? But this
yes.
This is the
Perfect.
one now. So
Yes.
that's what they can see for now. Then we can do part 2 quite quickly.
Okay.
You just need to let me know. Did we pause? Could we pause the recording for now?
Yes.
I can't do that.
Welcome back,
Are people
everyone.
back?
A few people are back. Some people are not back. I think most people are back now. Yes, and Nadine is back to sharing the PowerPoint. Welcome back, everyone. I hope you were able to have interesting discussions. We thought we would report back, or you would report back a bit quickly from the 3 groups. So I'll start by asking group 1, to report back, and that was Beverly, Colleen, Grace Ann, Edward, and Nicole. Does anyone want to volunteer to maybe share some thoughts around what mitigation measures you were able to come up with?
Edward, could you present for group 1, please?
You gotta catch that ball, Edward.
Edward seems to not be here.
Maybe
there's Edward.
Oh, there he is.
He's not catching the ball.
Well,
Does anyone else wants to catch the ball?
We nominate the great Nicole.
Can we stop sharing the screen?
All right, I'll try to do my best. Our group, we had quite a bit of a very fascinating discussion. We had our pet peeves and stuff, and I think pretty much most of us were on the same page. So in terms of our major challenges, that's what you said you wanted, or the mitigations. So
if we could focus on mitigation, I think that's
all right. So about the mitigations that we came up, to be very honest, ideally we would have wanted the evaluation to be timed better, being early out and being a part of the process. That's ideally. It should have been, instead of it being an afterthought per se, it should have been to us a forethought. However, considering that is why we had so many challenges, because it was not a part of the process. It was not built in. It wasn't automatic, and it was timed poorly. And but we still said that based on what we had, we would rely heavily on stakeholder engagement to mitigate some of those risks, to kind of put a structure in place, and for us to have that communication flow, especially having interviews done, to kind of make up some of those information gaps, to try to do the best that we can with what we had. So mitigations were basically in trying to put a kind of a structure to have that stakeholder engagement that will be consistent and have the communication flowing, and to try to use the interviews from different persons to kind of cross-check and validate the information that we had, and to do the evaluation as best as possible. However, honestly, it did not feel good that we were, because the context would have changed and the needs would have changed versus if we were there on the spot. So it reiterated the fact that evaluation cannot be an afterthought, but it needs to be a part in the process. And I shared that just like when you go to the hospital, triage is automatically a part of your process. Evaluation should also have that same importance in the process. It should not be an afterthought, as it seemed, because it was poorly, or in our perspective, was poorly timed. I hope I got your colleagues.
Yes, and another thing that came up was about the challenge of the unresponsive M&E focal point. And since we can't get through to this person, so we have to escalate and move to, whoever else, the operations manager or whoever the is at the head of the commissioning of the evaluation. And since email don't seem to work that well, we may have to try in-person meetings and that type of thing to get to people, to see if we can, because we won't be able to write that inception report if we are not in contact with some of the key stakeholders, and those sorts of things. The whole issue of, well, all right, I'm going the data gap, the weak M&E framework, or the lack of an M&E framework. It was suggested that we would have to, reconstruct a theory of change, etc., and to rely heavily on secondary data to move the process forward. Many more thoughts, but in a nutshell, those were some of the mitigating measures that we thought we would put in place.
Thank you so much, Nicole and Caroline. Well done. Room 2, are there any mitigation measures that you would like to add to those mentioned by Group 1? So Group 2 was Aliyah, Patricia, Shelly Ann, and Valerie.
Interestingly, our group, we had a different, slightly different thought. It was mentioned that perhaps, given the fact that it was a natural disaster and the uncertainty and so on, it may have been actually, I'm paraphrasing, to us that it may have been a little later on that, the evaluation would have been carded to take place. Because of all the uncertainty and so on, it may have been difficult in any event to really try to get things going. Nevertheless, in terms of the mitigation strategies that you would have wanted us to focus on, given the communication issues and the issues with coordinating with the M&E staff and the limited documentation and so on, we would have mentioned that, perhaps, would be best to just simply work with what we have. If based on the scenario, it would have been just a phone call in the evening. We would have we said that we would have to work with that to try to establish the targets, the indicators, and try to come up with some sort of a framework to at least start. So we would have agreement with their team and our team to really see the way forward. And yeah, that was basically where we're going. Because in terms of meeting, if the roads are blocked off in the north and then not blocked off in the south as well, there was no real way for us to be able to meet with them except on the phone when they are available. So we will work with them based on the circumstances. If there's anybody else from the group that would like to add, you can feel free to do so. But that was basically where we were with our discussion and our thoughts.
Thank you so much, Aliyah.
Yeah, we considered, Valerie here, we considered the fact that the M&A team had only arrived 2 weeks before. And so they were just getting their feet wet. We're coming in now to do evaluation. And so having to look at the operation in a really phased way, because even though it's 5 months on, the disaster, maybe the main thing to evaluate at that time would be, what was the immediate response? How did the first responders, how effective they were, things like that. And the distance, again, between the M&E persons and us. I think they're in Cap Haitian, we're in Port-au-Prince. It would make sense, as Ali has said, to collaborate with them and share information. What is happening on the ground in Port-au-Prince, in the different locations where we were. Share it with them, and then keep an eye on the ground over in that side for us, so that together, I think it would have to be a collaborative effort to come up with a framework that would make sense. Bringing on board, of course, whatever other stakeholders are available, because it sounds like few people in charge are around, and you have a disinterested operations manager who you have to sway in one way or another. It didn't say where he was, but yeah.
Thank you so much, Valerie, for those useful additions. Should we move on to group 3, which was Sherry, Nadine, Melanie, Othniel, Sharika, and Zara.
All right, so good afternoon again, everyone. For group 3, I'll just mention 1 or 2 things because some of the things were already mentioned. One of the mitigating factors that we identified as a group was to perhaps increase the number of M&E staff, or that we have to work with, because we identified the fact that one of the M&E specialists is Haitian, so they of course would speak the language. However, the other person, being from St. Lucia, may or may not be as fluent in the language. So to be effective in getting through to different individuals within the areas, we may need to hire someone locally who'll be able to do translation for the team as we move forward. So that was one of the factors that we identified. Of course, also technology, we understand that it may be a little spotty. One person identified that we could perhaps use drones, if possible, for aerial pictures, aerial views of the area, aerial views to get a better understanding of what may be happening in areas that we are not able to get through to because of the earthquake itself. Then also crowdsourcing, using social media platforms, again, if possible, to get secondhand information, and also, redrawing or doing a scenario recasting of the assumptions to kind of help with getting information for the report. Not sure if I missed anything else. Team, please feel free to jump in if I did.
Not really missed, but in strengthening the first point with respect to getting the additional support. Also noted the transportation time required between locations. So in beefing up the team, we could also divide the team to go to different locations, so we maximize we have overall time efficiency during execution.
Thank you, Othniel.
Thank you so much to Group 3. I think that overall we had some really useful suggestions. In the interest of time, because we just have 3 minutes left and a few slides left in my presentation, can I ask Nadini to reshare the PowerPoint? Yes. So I think that some of what you mentioned, I will repeat here. Up top, I do want to say that, as in all evaluation practice, contextualization is so important. So whatever mitigation measures you come up with or whatever challenges you face, I think all solutions always have to be adapted to the context, both of the country, the crisis, and the organization that you're evaluating. Here are a few suggestions for measures that can serve the evaluation, and these are from the ALNAP EHA guide from 2016, and there's much more there if you want to read and have more information. So obviously one big challenge is lack of documentation and data. So one way of finding a solution to the fact that there is no formal documentation, there's no formal data, is to reconstruct a chronology of the crisis and the humanitarian action. And you can do this as an interactive exercise with staff if they're available, or you can do that by pulling bits and pieces from different interviews, from secondary data, etc., just to get that overall understanding of the crisis and the program that you're evaluating. You can also use recall. So instead of searching for that formalized documentation for those reports, you can ask crisis-affected people and local key informants about the extent to which conditions have changed. So when you don't have a baseline, when you don't have baseline data, you can instead use recall and ask crisis-affected people how they've experienced the change brought by the program that you're evaluating. I think somebody mentioned, one of the groups mentioned reconstructing the theory of change. Of course, that's a very valid solution where you can use interviews with agency staff to identify actual or implicit objectives and how they might have changed over time, because I think that's important, just as we discussed earlier in the session, that the objective at the beginning might not have been the objective after 3 months as condition and the crisis changed. Next slide, please. Another big issue that was highlighted in the scenario is the fact that there's a high staff turnover. They might have left or just simply don't have time for the evaluators. You can, of course, try to reach out to former staff to participate in a remote interview or do an online survey. If you get the information for former staff, sending out a very short online survey might be a solution. I've actually participated. I was asked once to respond to a survey after I left the crisis. So that can be a useful tool. I try to identify if there has been staff that's been there at the beginning. In this scenario case, it was an INGO, so there was international staff, but there might have been local or national staff that were there from the start. So looking for that staff that have been there the longest, and that could even be, doesn't have to be directors or managers or meal staff. It can be drivers. Drivers have very good understanding often of activities that have taken place and can kind of help reconstruct a chronology, for example. And then, of course, you need to be sensitive. I saw something in the chat about ethics. That's important. It's sensitive to the pressure that staff may be facing, both in terms of their work, but they might be also very personally affected by the crisis, and try to find light ways to engage them. Ask them what they want to know about their work and in which areas they're keen to see change. So really try to respond, have that utilization-focused approach and try to meet their needs in terms of what they would like to see come out of the evaluation. Next slide, please. When it's difficult to reach affected location because of security risk or damaged infrastructure, that's very important to discuss with the commissioning agency at the outset of the evaluation and then to build that contingency time into your plan. Somebody mentioned hiring more local staff on the evaluation team for translations. They can also be very useful in understanding kind of what the situation is in terms of access, in terms of where it's safe to go, not safe to go. And you can always consider letting the commissioning agency plan the visits. Of course, the evaluation team should set the criteria for where to go and when. And then consider remote interviews and surveys. That was mentioned as well by several of the groups, I think. You can use commonly used channels, for example, WhatsApp. I think that's a global tool nowadays. And WhatsApp is very useful because you can do polls in WhatsApp, for example. And I know that was used in a real-time evaluation in Gaza, in Palestine, to gather feedback from affected people, sending out a poll in WhatsApp. That's a real simple tool, but you can gather super valuable data when you don't have access and can't meet with people. Next slide, please. And then, yeah, lastly, just when engaging with the affected population, avoid time-consuming methods such as focus group discussions if that's not feasible. You can opt for consulting members of the affected population while they're waiting for distributions or transport and use direct observation. So keep that in mind and kind of be sensitive to what they're going through and adapt the data collection methods to what's feasible and ethical in that particular situation. And design data collection methods and ways of engaging with the affected population that are sensitive to trauma and fear. If there's been a lot of violence, for example, you might not want to you might need to be very sensitive around what they have experienced and so forth. And I think that's super important. And the same way that with the staff, you might want to understand what they want to see out of the evaluation. For me, that's the same with affected people. What you can ask them, what's the kind of key messages that you have? If you only have 5 minutes, 10 minutes with somebody because they're undergoing a lot of stress, then if you have the possibility to talk to them in 5 minutes, okay, what's the one key message that you would like to transmit and that you would like to change in regards to a particular humanitarian response or program? So I think that was like my last slide. If we can take, yes, next slide. So those were a few mitigation measures. There's much more in our EHA guide. So please, you can download that guide if you're interested in knowing more. If you want to stay in touch with ALNAP, we have a monthly bulletin, and you can also sign up to our M&E list. You have a QR code on the screen, but you also have links in the chat. Our next session, ALNAP CEI session, is on February 25th. And then we'll get real nerdy, I was going to say, and look at evaluation criteria and how the OECD-DAC evaluation criteria can be adapted to the evaluation of humanitarian action. And that's, of course, based on the guide we published last year. Thank you so much for your attention, and thank you for your engagement in the group discussions. I'll hand over to Valerie, I think, for just a last few words. And apologies for running late as well.
Yes, thank you so much, Sarah. This was really fun, really interesting. I'm sure everybody is energized by it and looking forward to part 2. Unfortunately, a few persons had to jump off, but we're very eager to receive the outcome of this activity. So we'll be sure to circulate it widely and look forward to them participating in the next round. So thanks all for attending. Thank you, Sarah. and all Waramu who made this, really engaging. And of course, thanks to our CEI personnel for supporting. All the best, everyone. Have an enjoyable rest of your day or evening. In the case of Sarah and Waramu, it must be very, very late over there in Nairobi. So, thanks for sticking with us.
Thank you so much, everyone.
Thank you, everyone. See you the next session.
Thank you all.
Sorry, guys. I'm sending a feedback.
Bye.
Putting a feedback link in the survey.
Oh, feedback.